She could have social anxiety. She could be exhausted after interacting with people because of the masking. I mean, if you could think about being on for a job interview and doing that every day in school, it's exhausting. And then the problem is what happens there is they have relationships. Girls have more desire than boys to have those relationships, but they're more surface level. And as they get older, you're going to be able to see that they have less deep relationships. And then even if they are really good at masking, and especially if they're really good at masking, these girls can feel extremely isolated because they have these friendships, but they're not being truly seen by anybody. And that's very isolating. And that can lead to just feeling like nobody really knows the real me. And then that can be, that could lead towards anxiety, depression, things of that nature.
My colleagues and I have noticed in our clinic that on average, boys with autism tend to have more what we call externalizing symptoms or disruptive behavior. So examples would include things like hyperactivity and aggression. And that you can imagine would garner more attention from parents, from other caregivers, from daycare providers, teachers, primary care, providers. So girls with autism tend to be quieter. And again, this is not across the board, but on average. And so they might not attract as much attention from adults. And there are studies that have shown that girls tend not to have, for example, as many repetitive behaviors as boys. And that's one of the important features of autism that we look for when we're doing an evaluation. They might have less obsessive interests, or their preoccupations might seem less odd. So I remember clearly a boy in clinic who was obsessed with batteries, which seems a bit of an odd preoccupation, whereas I've met girls who are obsessed with collecting pencils, which might not seem as odd. And they are, tend to more likely mimic other children in social situations and try to fit in. So they might seem milder or less obvious than boys with autism.
More boys are diagnosed than girls. Do you think this is genetic differences, cultural bias, different processes, double standards?
I think the answer is complicated because there are probably a number of different reasons for that skewed ratio. So one is just what we were talking about, that there's difference in symptoms, that it might be just less obvious in girls than in boys. So they are being misdiagnosed or late diagnosed. Another reason could be that the diagnostic measures we use in clinic to help evaluate kids with autism were really developed on mostly boys. So they're kind of geared toward detecting symptoms in boys rather than girls who could have different symptoms. And then what we also discussed, that girls can mask their social challenges trying to fit into social groups, which also means that they could be, misdiagnosed or underdiagnosed. But still, controlling for all of these different reasons, people suspect and have kind of calculated in various studies that the ratio still is skewed to maybe 2 or 3 to 1. So that tells us that there's probably still a role for biological processes that differ between girls and boys. So one interesting finding from genetic studies is that girls with autism tend to have more deleterious genetic mutations. So an example is that they have larger copy number variants. So copy number variants, or CNVs, are basically regions of the genome that have been duplicated or deleted. So we're kind of used to thinking about having 2 copies of every gene, one inherited from her mother, one inherited from her father, but actually nature is more complicated than that. So I could have 1 copy of a gene, you could have 3 copies of a gene, someone else could have 2. And that might not cause any problems, or it might be associated with a condition like autism. And so a number of genetic studies have found that girls with autism tend to have larger copy number variants, these genomic duplications and deletions, and that these stretches contain more genes that are affected by that variation. So this also implies that there might be female-specific protective factors to developing autism, because if it requires a greater genetic hit, like a more deleterious genetic mutation to develop autism, that perhaps girls have some resiliency factors, which we're not clear about what they might be. But if there are such things, we would really want to know so we can leverage them to help other individuals on the spectrum. And it's actually a big topic of research in our field, is sex differences, the female profile, and trying to figure out if there are such female-specific protective factors.
Do you have advice, like any questions they should ask if they suspect their daughter has autism?
Definitely, if they suspect autism, they should definitely ask their primary care provider for a referral to a specialist who has expertise in evaluating children with developmental delays and autism. So that could be a developmental behavioral pediatrician, like my training, or could be a child psychiatrist or a child psychologist. They should be prepared to provide, very detailed developmental history. That's what the specialist will want to know. And then a description of their behavior in various settings, such as at home and in school and public. Medical history is also important to provide because clinicians often want to rule out a medical cause for a child's, for example, temper tantrums or difficult behaviors before saying that this is due to autism. But yes, they should definitely seek out a referral to a specialist who can help diagnose their child.
With interventions, are there different things? Like, do girls need more social, more emotional support groups or things like that?
I think that girls tend to internalize more than the boys. So they're more at risk for depression and low self-esteem. So having somebody to talk to, maybe even individually, could be extremely helpful. Like with CBT, you teach about, for the cognitive part, you teach about automatic negative thoughts or cognitive distortions, black and white thinking, jumping to conclusions. And that could be really helpful for a neurotypical person or a person that has the ability to decipher and doesn't have too much anxiety. But when you're looking at somebody with OCD and you're trying to rationalize those automatic negative thought records and things of that nature, those interventions aren't going to work very well. Like some people will take the social skills and the ABA and it'll really help them. And then other people, it can really hurt and harm. So it's a matter of knowing your child, checking in with them, seeing the progress, but honoring what they say as well. Because for some people, those things can be so helpful, and for others, it can damage them terribly.
What would happen if a parent suspects their daughter has autism, but like the school psychologist doesn't agree, or provider doesn't agree, or they misdiagnose them with something else? What happens in those cases? What should a parent do? Like, keep on?
Just because someone says no, it doesn't mean it's no. And I think it's really important to know that you're an expert on your child. You're the one that lives with your child. And if you feel something's wrong, you need to be heard by somebody that you feel is in line with what you're seeing.